Going right to go. There are 20 active cases of coronavirus in Victoria. That's one additional case, a locally acquired case that was notified to the department in the last 24 hours. We'll go into the details of that, such as they are, soon. 20,116 test results received today. That's a strong number. I want to thank every single Victorian who went and got tested. It is the most important thing. Any symptoms whatsoever, get tested and do it as fast as you can. We'll get your results to you in 24 hours, and you will have played such an important part in keeping us safe and ensuring that this is a short circuit breaker event that can bring a sense of confidence and control to our coronavirus circumstances. That means we've done 4,672,661 tests since the beginning of the pandemic. Now, in terms of the Holiday Inn, that now means we have 14 cases that are linked to that particular premises. The additional case is a social primary close contact, a friend of one of the Holiday Inn workers. Overnight, and within 8 hours of that test coming to us, all 38 household primary social close contacts of that person have been contacted, have been locked down, and we have already begun the process of testing each of those 38 people. That'll be a big focus of our efforts today, and we hope to be able to report negative results, and all results I should say, as soon as they come to us. That's most likely a feature of tomorrow's briefing. That will be a very big focus today, to get all those people tested, get them through the labs, and hopefully rule those people out. In terms of the Holiday Inn more broadly, as of last night, we've identified 996 known primary close contacts that are related to that particular facility and the people who work in it. As you know, that number will keep on growing because as we find more and more people come forward, QR codes, all the interviews, contact tracing. So that's not a bad thing. That's in fact exactly what we want, the strategy working, finding more and more people and then putting a public health response around them. We will be able to I think Jeroen will be able to take you through how many we've had test results from and how many we expect to start to come through in the next couple of days. Today's not the big day for those results. The balance of those will start to come through tomorrow, Monday. That's why we chose Wednesday as the important day, a 5-day circuit breaker, not 3 or any other shorter period of time. In relation to Brunetti's, I'm very pleased to be able to say that 11 of the 12 Brunetti staff have been tested and they have all come back negative. That is very significant, given that they were at the highest risk of exposure, given their proximity to the infected co-worker. Doesn't mean that all the challenges in association with that business, their customers and the Terminal 4 issues are over. Far from it, but that's very positive news. You'd obviously always prefer to be getting negative results than positive results. Just before I ask Jeroen to add to my comments with a bit more detail, a bit more specificity about some of the work that has been going on and continues 24/7, just a couple of points. Firstly, the Prime Minister has agreed to suspend flights, as I had asked, during this 5-day period. That takes a little bit of time. It's not an instantaneous thing because, of course, flights are already in the air and people are already well and truly on their way to coming home. They may be in transit, they may have stopped in Singapore, for instance, or another place to get a connecting flight, all of those issues. So there'll be 5 more flights arrive between now and midnight, and we think there's about 100 passengers on those. They'll be appropriately taken care of, but there's no further flights beyond those 5 until at the earliest next Thursday, but we'll keep you informed of that as we get closer to Thursday. Just in terms of the broader issue of hotel quarantine, I've asked our experts to look at a risk assessment in terms of these issues in light of this rapidly infectious, fast-moving and very, very infectious UK strain. I don't have obviously the outcomes of that thinking, but when I do, I'll certainly have more to say, and that'll be Victoria's position in hopefully a national discussion about the real risks that this UK strain poses to us, both now and until we get that vaccine rolled out. Just finally, I know that a lot of people will be hurting today. This is not the position that Victorians wanted to be in. But I can't have a situation where in 2 weeks' time we look back and we wish we had taken these decisions now. I've got advice to do it, I've done it. It's based on science. I know there's a lot of pain out there, and I will have more to say about support for business and support for others who have been negatively impacted by this absolutely necessary public health measure to protect all the things that we've built, this precious thing that we've built. Victorians know what has to be done. We've done it before. We've shown a courage and a character and a compassion for each other that sets us apart. That's exactly what's happening today, but I know it's not easy, and that's why there'll be support there, and I'll have more to say about that at the appropriate time. I'll now ask Jeroen, as the testing commander, just to take you through some of the numbers that sit behind the broader picture that I've painted, and then we're happy to take any and all questions you have.
Thank you, Premier. Good afternoon. We received 20,116 tests yesterday. My thanks again to everybody who's come out and got tested yesterday. We also have 8,500 negative results in already this morning, and then a further 7,000 or so tests already in the lab that are being processed. So we are seeing a continuing trend over the last few days of a very solid testing performance. Our testing centres are all open for business. We're seeing some very solid numbers this morning. Wait times are around 60 minutes to up to 2 hours. Again, I would urge anybody anywhere in Victoria who has the remotest symptoms, please, you must follow your colleagues who went out and got tested yesterday. Please come and get tested to ensure we can really get as much information over the next few days of where this outbreak has got to. Yesterday we discussed a number of lines of inquiry that we were actively following up. The most important of those and the most concerning of those was of course the Brunetti Cafe. All 12 staff who were exposed to the cafe worker have all been tested. 11 of those have already returned a negative result. We have one more test result that we're waiting on today, and I expect that to come through later on today. That is an encouraging start. We also have 38 customers of Brunetti's Cafe who've been contacted. We got the details from them late yesterday. They're all being followed up last night and this morning. We will be interviewing and testing all of them and their household contacts to establish if they've had any exposure at all to this. Can I also add that the people, including the Brunetti staff who've tested negative, the people who will be part of this investigation will all be isolated for 14 days. So even when they return a negative test result, which of course is a very encouraging sign, they will continue to monitor them very closely during their lockdown of 14 days. We've also been exploring a number of other potential exposure sites such as the RAAF base at Point Cook, the Coates Hire in Werribee, Avondale Primary School, Camberwell Grammar School, and Terminal 4 with respect to a cleaner. I'm pleased to confirm that all of those primary close contacts at those venues have all returned negative tests. Again, that's a really encouraging sign. So the lines of inquiry that we've been following for the last 48 hours have been followed up swiftly, have been followed up promptly. We've identified the primary close contacts very quickly. We've tested them and we're seeing negative returns, which of course tells us that we can start to exclude those venues from our ongoing investigation. With regard to developments in the last 16-18 hours or so, late yesterday we found a positive result of a man in his 30s in the Point Cook area. He is a social contact of one of our CQB staff members. We're continuing to investigate the full extent and nature of those contacts, and that work continues. We've identified last night 38 primary close contacts of that particular individual. All of them were contacted last night. We have asked all of them and their households to remain fully isolated. My testing teams and our interview teams were out this morning early following up each of those households and those individuals. All of them will be interviewed today. All of them will be tested today. We'll obviously seek to get those testing results as quickly as possible, and all those individuals in those households will be locked down for the full 14 days. My thanks to them for being part of this investigation, and we know it's not easy for any of us as Victorians to be going through this short, sharp lockdown. It's even harder of course for those who are at the centre of our investigation, but it's so important, as we've done with previous outbreaks, of course including the Grand Hyatt and all the outbreaks before, and as we're seeing, as we follow these lines of inquiry swiftly, we identify the people, we lock them down, we get them tested, and where there's negative results we can move on to identify the new priority areas. There are some additional exposure sites that have gone up on our website in the last 24 hours. The most specific of those would include a private dining venue at 426 Sydney Road in Coburg. We also have exposure site at Coates Hire in Werribee. the Caltex Woolworths in Hopper's Crossing, and the number of public transport routes, the 901 bus route from Melbourne Airport to Broadmeadows Station, and the Craigieburn line from Broadmeadows to Glenroy Station, and then the 513 bus route from Glenroy Station to Eltham. We are working, and as I was walking up here today, we will be identifying a couple of other exposure sites at Point Cook and Albert Park. Details will follow shortly on our website. Finally, just with regard to the airport, last night we messaged around 2,300 people. These are primarily travellers who came through Melbourne Airport Terminal 4 on Tuesday the 9th of February in the morning at the time of our exposure. All of those passengers were messaged to the extent that we need them to isolate and to get tested, and we are following up with calls today. In fact, I spoke to a couple of them myself this morning. So we are following up with calls today to all of those passengers to establish their actual movements, to establish any particular exposure they have, and we'll be dealing with each one individually to establish what are the appropriate arrangements for them in terms of what they need to do in terms of isolation. If anybody listening is receiving messages from us indicating that they are a close contact and they must isolate, I would ask you please to ensure that you do so that we can continue this investigation and make sure we run this to ground quickly. I think with that we will take any questions.
With that private dining venue, what was the event that occurred? Was it a wedding, or can you cast any more light on what was actually occurring there?
Yeah, so again, look, we're still early in the investigation, and the positive case we identified late last night was at a private dining venue with some extended family members. That's quite appropriate. So we've identified all the people who are at the venue, including the staff, including the other wider family members who were there. All of them have been contacted. They're all being interviewed today, and they're all being tested today.
Premier, can I ask you, the man with the nebuliser has told the Age that he's in ICU now, and he told the Age from ICU that twice he told health officials that he had a nebuliser.
Yeah, I've seen those reports. That's not consistent with the normal practice that's followed, but I can confirm for you that the head of CQV will be out later on today, and she can take you through all of those issues. They've had an investigation of that matter, but I really can't add any further comment than that. But Emma will be out later today, and she'll be able to answer any of those questions.
Emma
but clearly
did say that this person did not report the nebuliser to the hotel. This man says that he did twice and was given permission to use it. Why were Victorians given the wrong information?
Well, no, I think you need to be very, very careful not to assume things. Emma's said what Emma has said. I find her to be a person that's accurate in the statements that she makes. Let's not assume anything. I think it's best if you speak to her later today. She's going to come out and speak to these issues and any other questions that you have.
You also said, I don't think this man knew he was doing the wrong thing, so you imply that he didn't report it.
Well, I act on the advice I've been provided by CQV.
Aren't you concerned, though, that the advice was wrong, or you were given the wrong information and this man's being made to feel like a criminal?
Well, can I put it to you that I've been invited many times to reflect upon this person, and I have been very consistent not to do that. I've been very consistent in not doing that. I don't think that's fair on him or anybody. But as to the specifics of what did or didn't occur, CQV are the people to answer for that, and they will, because the head of CQV will be out to answer any of your questions later on today. I don't have an exact time, but she'll be out later on.
It's pretty important, though, because it's what went wrong inside the hotel.
And that's why the head of the agency is going to come and talk to you about any issues that you want to raise with her.
Are you planning on apologising to this person?
Sorry, well, I think I've just established for you that you're putting a contention to me, and I don't agree with that. So the answer to your question is no. You should speak to the head of CQV about those matters, and despite the invitations, and I think you might even have invited me a couple of times to reflect on this person, I have not done that. I have not done that, and I won't do that.
My criticism has only been the way the hotel quarantine program has been run, because it's been...
Well, in any event, I'm not reflecting on the person. I never have, and I'm not now.
You may not have reflected on the person, but did you say things that were inaccurate?
No, I don't believe I have said things that were inaccurate. I go off the advice that's provided to me, and as to what's gone on here, then the head of the agency will be out to speak with you later today, and she can go through those issues.
Are you 100% confident in the information that you have been given?
I have no advice that sees me doubt what I have been told by CQV. In terms of these issues, I'm not reflecting on the person. I don't think that's fair. And that's not just something I'm saying today. I've said that for a number of days because I don't think it is fair. Ultimately, it is my understanding, and the advice I have is that machines have been taken from people. That is the normal process. If somebody speaks to the fact they have one of these machines, then they don't use those machines. That's the normal practice. I can only give you the advice I've been given, but one better than that is for you to be able to speak to the head of the agency and she'll be able to talk to you.
Well, Premier, there is growing concern that this circuit breaker will turn into an extended lockdown. What's your advice to people who are really worried?
Yeah, I don't think that people should be. I think people should be based, should try as best they can, and I'd encourage people to be based in the facts. And the facts are that this is a precautionary approach, one that's based on the best health advice. We are getting to people very quickly. We are testing people, and we are getting many very pleasing negative test results. However, part of that abundance of caution is the assumption that there are cases out there that we don't know about and that were not necessarily caught up in the net that we had cast once this outbreak started, because we simply didn't know about them. The notion of people having given it to others, that it's out there in the community more broadly. We have to assume that's happened. Because not just an assumption, but as a matter of fact, we know this is moving really, really fast. However, all my advice is that this strategy is exactly the right thing to do, and I would urge Victorians to stick together. I'd urge Victorians to be focused on the facts, and we'll be here briefing you every day along the way, and there's no cause for anyone to be speculating about that. Based on what we're seeing so far, the advice remains the same to me. This is an important thing for us to do, and it's exactly what we need to do. A 5-day circuit breaker, yes, painful, but something that the advice to me is will be effective in pulling this up. Now, I cannot provide. It would be irresponsible for me to try and provide a cast iron guarantee. But we're all working as hard as we possibly can, and we can't do this on our own. We need Victorians to play their part as well, and with a test number over 20,000 again, which means it's been a very big week of testing, I'm so grateful to Victorians because they are doing that. They are stepping up.
The Chief Health Officer's directions actually have the end date of the 26th of February. Why is that?
Well, I think he's explained that, but I'll let him add to his comments.
All directions have always been written until the end of the state of emergency period, whenever that relevant state of emergency period has been extended. So that applies to all directions across all periods. So they will be revoked at any point where we think the settings need to be changed. So that's applied previously when we've already had a flagged date of easing of restrictions. We've still had an end date to the end of the state of emergency period. So there's absolutely nothing different in the way directions have been written at this stage. That's always been the way that legal have approached it, and nothing should be read into it as having an intention to extend beyond a day beyond when we think they need to be in place. And for now, that's 5 days, absolutely.
Why not write into this 5 days and then extend?
Oh, you'd have to ask legal about why they draft in the particular way that they do, but clearly they've done it all the way through from the beginning of last year with respect to writing directions.
So what are your thoughts though? Is this, I know there's no guarantees, but is 5 days realistic?
I think 5 days is realistic. Clearly we need to make an assessment each and every day. We'll look very, very closely in the 24 hours leading up to the 5-day period, but we will have a great number of results back, and we'll have almost all, if not all, of those primary close contacts through. But it does depend on whether new cases emerge or any other surprises that might occur. But I'm confident that 5 days is enough. But we'll do whatever's necessary to get on top of this.
Sorry, looking at it from a simplistic layman's point of view, this strain is very, very virulent, is meant to rip through the community. But so far, there's no evidence of that, is there? We've had one community transmission today, and it's been basically out there almost a week. So are you surprised there's not more cases?
No, I'm not. I think the way that we've chased down cases and their close contacts and their secondary close contacts is part of that containment strategy. It's certainly shown itself to be infectious. The way that it's transmitted to household members at a high rate and in a rapid period of time is a sign of its infectiousness. But we've chased down each and every case immediately, and I think that's the difference. But the way that it's played out globally, and this is the same virus, that variant of concern, the B117, has taken off. It's taken off across the UK, now becoming the predominant strain in many countries in Europe, and doubling every week, 10 days in terms of its prevalence in the United States. It is looking like an extremely infectious virus. That doesn't mean that you can't get on top of it, but it does mean that you've got to have everything lined up and really robust in order to do so. And this short, sharp circuit breaker is part of that effort.
This virus has been around since September, and we're just hearing so much about how infectious it is now, and we weren't really hearing about the risk it poses to the community when tennis players are coming into the Australian Open. I suppose my question is, how is it that New South Wales hotel quarantine can take residents with the UK strain and not have it leak from their hotels where Victoria would just become unlucky again?
Well, I think hotel quarantine has shown itself to be a challenge across all of those places where there's a formal hotel quarantine process in place. A number of, and breaches is the wrong word, sometimes it's everyone doing the right thing, policy settings appropriate, but a hugely infectious virus. New Zealand's had multiple episodes, Sydney's had it, Brisbane's had it, Perth's had it, South Australia's had it, and Melbourne's had it. So we all have to face up to the reality that getting to zero risk is an almost impossible challenge, but it doesn't mean that we don't look at each and every circumstance and make sure that if there's tightening of policy, if there's tightening of procedure, if there's any process of critical review, that we don't make changes accordingly. But it's not to say that this is unique to any place that has a formal quarantine program. And clearly the places that have a pretty high throughput, and we've had 35,000+ through Melbourne, have a significant risk of these circumstances occurring. That's part of the risk assessment that we need to do going forward.
There are figures today that with contact tracing that 8.9% were not contacted on Monday within 48 hours, and that ballooned out on Tuesday to over 43%. Were you concerned about that?
No, the common operating picture, you can Google it, common operating picture COVID, is published on the Australian Government website. For the week, it's above 95% for contact tracing within 48 hours. There are small subsets for people who we regard as primary close contacts that are sometimes a small and tricky subset to contact. So that includes, we've made, for example, some exposure sites, we've made them primary close contacts. So instead of regarding them as casual and just saying please test and go back to your normal business after you test negative, we've said you need to quarantine for 14 days. We're going to follow you up robustly for that 14-day period. Some of those exposure sites, we can only capture them through QR codes, and the information in those QR codes are not as straightforward as when you do a full interview of a case to find out their primary close contacts and so on and so forth. But overall, and again, it's public information, we're at over 95%, and the last common operating picture I've seen has us at 1.3% beyond that 48-hour period. I think that goes to February 11. With small numbers, and we've got small numbers in Victoria at the moment, we can't draw very broad conclusions. There is some evidence from overseas that the serial interval, the time between generations of cases, might be a day shorter than for previous variants or for previous coronavirus strains. We've clearly seen transmission occurring within a very short period of time. That may just be an artefact of the small numbers and unlucky cases in those circumstances, but we can't assume that. And we know that overall there's very strong evidence for 40 to 70% greater infectiousness with the B117 strain, and so we shouldn't be surprised if we see short incubation periods and high attack rates within households. So a large number of transmissions within households. Normally that's a minority of cases, but it's a significantly higher proportion with the B117 strain.
Are you feeling I know obviously tomorrow and Monday, Tuesday are really the key dates, but are you feeling confident with just one case today or?
I'm always going to be happier with one case compared to 5, absolutely, but there's no complacency here. We are chasing down the almost 1,000 primary close contacts to make sure that they're all interviewed, they're all tested. We have to make sure that each and every primary close contact and their close contacts are isolating appropriately. So there's no sense of sitting back on our laurels here. We will chase this down with a vigour like nothing else.
I don't know whether this is for you or for the Premier, but in terms of construction, what construction should be continuing now and what should be stopped?
I'll let the Premier answer. Certainly the public health advice is pare back where you possibly can for non-essential construction work, but there are circumstances where it's a safety issue to do so very rapidly, and sometimes over a period of 5 days it's really not appropriate to go through that just to build up again. But I'll let the Premier answer.
I really can't add any more than what Professor Sutton said. For some projects, Nick, there'll be by the time you stop the job, the 5 days would be up. So you've got to make them safe. So we'll see, I think, across the board, there'll be less activity in almost every sector. And that's exactly what we need to do. As painful as that is, that's how we limit movement, that's how we limit the spread of this. On construction and any advice or guidance we've given to industry associations and other project specifics that have people who've come to us, I'm more than happy to chase that up for you.
But it just seems, certainly out there at the moment, it's a bit vague amongst, there are a number of sites that are still working today that wouldn't necessarily...
Well, let me chase that up for you. Again, that's the difference between a longer shut and something that's short and sharp. It does present some additional challenges to us around, some things that you'd barely have given effect to the decision before the 5 days would be up. So it's a little more complex. But if there's any specific projects that you need some clarification on, we're more than happy to chase that up for you. Sorry, you're next.
Why isn't Emma here right now? She was part of your press conference 2 days ago when you were talking about the nebulizer, the issue today. Why is she holding a press conference later?
Because she's holding a press conference later. Like, I'm not going to sit here and debate her diary. She's got quite a bit of work to do, and she's really busy doing it. And I've told you.
You're trying to distance yourself from the issue.
Well, I wouldn't suggest you should not take that view. You shouldn't draw that conclusion because that's simply wrong. That's simply wrong. She'll be here later on today. But I'm not in charge of her diary. She's got a lot to get on with. Very busy person. And maybe it just suits her to be with you later on today rather than now. Maybe she's doing lots of other work.
Why is she doing it though? Having made a number of comments about it, why is she then the one clarifying it, not you?
Because she runs the agency, and my comments are based on the advice that she's provided to me. So I don't really think there's an issue here. If seriously the biggest issue today is the timing of press conferences. Sometimes we all stand up together. Sometimes Jeroen will be here. Sometimes he won't. Sometimes Alan Cheng's here, not Brett. There should be nothing more or less read into that than it's just about what works best for a very busy group of people.
Premier, you know that's not what I was implying. What I wanted to get is, you have made statements. Are you going to stand by those statements?
I've already answered that.
It's just such an important issue though, because it is what you're saying caused this outbreak. Is that a resident brought the nebulizer into the hotel without telling authorities? He says that he tells the hotel his permission to use it. It just seems strange that you won't go into it a bit more.
Well, no, it's not strange at all. I think the most important thing to do is to have the head of the agency speak to you about that issue, the review that she conducted, not me, the work that she's done, the advice she's provided, where she thinks it's up to, and you may well have other questions for her. Well, beyond this issue.
But if this sparked this outbreak, wouldn't you want to get to the bottom of this and be super clear and transparent with everyone?
Oh, look, we're back where we started. I'm just not standing here having a debate with you or anyone else about the timing of when people stand up.
Okay.
She's doing a press conference later this afternoon. She's a very busy person. That works for her. Clearly, she couldn't be here with me now. She'll be here to answer any and all questions you have.
Just on another matter, policing. How have you spoken to the police about administering fines? And just can you clarify what you can and can't, not the whole list of things, but people have to wear masks.
Yep.
Will police be cracking down on anyone who's...
Yeah, look, Victoria Police will continue to do that challenging work, but very important work. The rules are clear, and if people just apply good judgment as well, then I think it becomes much easier. There are those 4 reasons, those 4 well-known reasons to leave your house. You need to wear a mask everywhere if you're not in your own home, and I just ask people to use that good judgment, that common sense. Police always exercise a degree of discretion, and fairness is important to them. And if someone's made a genuine error, then and they've tried their best, that's something that police always handle well, I think. And I just hope that there's not a need to be issuing fines. That people understand that this is painful, but a short, sharp circuit breaker. We will get through this. As Victorians, we know what to do to beat this virus, and I'm confident we'll do that again. And I just say to anybody who thinks that the law doesn't apply to them and that they can be off protesting or doing whatever else, all that potentially does is spread the virus. And a protest is not the same as a vaccine. It just doesn't work. So let's not put police in those difficult positions. Let's all of us just try our very best to follow these rules for a short period of time, so that we can hopefully keep getting those negative tests coming through and put this behind us. That's the aim. And let's not any of us make that task and that job, particularly the job of Victoria Police, any more difficult than it is.
Is there any specific targets that we need to reach to actually have the circuit breaker lifted?
No, look, because you're talking about such small numbers, what we want to see is a continuation of negative test results amongst people that we have the highest degree of suspicion that they might have become infected. We also want to see the broader community test numbers stay high, and again, thank you so much to every Victorian who has this week come forward and got tested. We've been well over 20,000 throughout the week, and we want to see all of those people who we know need to locking down, and we're so grateful to them. They're not looking at 5 days; they're looking at 14 days, and without their cooperation, without their absolute commitment in this shared effort, without them, then the strategy doesn't work, and they're all doing a fantastic job.
On the topic of the healthcare worker infection prevention and wellbeing task force, it was set up to help people in the hospitals and like people working on the forefront to protect themselves from the hospital. Why doesn't the task force include hotel quarantine?
Because hotel quarantine, as I understand it, has its own infection prevention and control expert panel that they seek advice from. There's a deputy chief health officer that is directly appointed and has only one job, and that is to run the public health side, the medical side, if you like, of the CQV work. I think there's sharing of information goes on all the time, but they're not relying on what's occurring in hospitals or had occurred in hospitals. They have their own team, they have their own focus, because their environment is obviously unique. That's the advice I have.
What we're being told is that there's not sharing the lessons that they learned in the task force aren't actually then applied in hotel quarantine.
I have no advice to confirm that. I'm sure you can speak to Emma about that, but I wouldn't want anyone to assume that there's anything other than a real focus and absolute attention to these matters. CQV, as I said, have their own team. They're not looking to use somebody else's team from another environment, and I think we could all agree on the fact that hospitals are different to hotels in many, many different ways. They're similar in some ways too, I'm happy to concede that, but they have their own team. As for the information flow back and forth, I don't have any advice that confirms that view. Emma may be able to cast further light on that.
Is your understanding though, that the intention was for advice and information to be shared across?
My understanding and my expectation would be that all relevant material within any government department would be shared with everyone who needed to know about it, and it was my my sense that was happening. I certainly don't have any advice to say that it wasn't. So I think probably the best person to be able to take you through in quite some detail about the infection prevention and control framework that they have as their own framework with this specific task and no other task is the person who leads that team, and she'll speak to you later on.
And what's happening with this outbreak in Melbourne? Are you satisfied with the speed of the rollout of the vaccine? Opposition leader Anthony Albanese tweeted last night some criticism that the approval for the vaccine happened 3 weeks ago and we're still waiting. Do you share those concerns about a delay?
Oh, look, I've always tried to not be critical during what is a state of emergency of anyone, whether it be a person who doesn't follow the rules or a person who, makes a call, or the rollout of a program, or that doesn't serve any purpose. I know that Greg Hunt and the Prime Minister, in partnership with all state and territory governments and a massive team of people, Brendan Murphy and so many others, are all working as hard as they can. We're in a unique period. So now, between now and when we start to see particularly our vulnerable Victorians get the jab, not can I say so much those frontline workers, they're heroes, they're doing great jobs, but we can't be certain that it protects you against giving it to other people. So the most important cohort in my judgment is those people who, if they get this, are at that much higher risk of becoming gravely ill. So, we're all working as hard as we can. That's principally a federal government issue, but I'm in no way critical of the federal government on any of these matters. I just don't think that serves any purpose. Any purpose at all. Sorry.
There seems to be some discrepancy around exposure sites. So we're listing T4 as the exposure site of Melbourne Airport on
Yep.
the 9th, I think, I believe. However, Interstate, there's definitely 8 in New South Wales and the entirety of Melbourne Airport on a couple of days earlier than that. Is there something that we're missing, or are they, off the mark?
I think they may have made a judgment that's a broader judgment. We're basing our designations based on facts and what we know, interviews, all of that. That doesn't mean it wouldn't change at some point, but perhaps we can have a look at what they've done and have a conversation with them and try and get to the bottom of why there's a difference.
Will there be...
Sorry.
They're being more cautious. New South Wales have said that their contact traced 7,000 people who went through Melbourne Airport on the 7th and 8th, which is a Sunday and Monday. Why would they be being more cautious?
Well, I'm not sure exactly what they're doing, because there's been, I think, in the last 12 hours or so, there's been a couple of different positions. I think they might have had one view and then they've changed it. I think you're best to speak to them. But look, Brett speaks with his counterpart in Sydney all the time, and maybe they can have a conversation and see what the differences are, if in fact there are any.
Will there be compensation for businesses that are suffering, particularly the hospitality?
Sure.
And how quick will it be? Because many of them say this was going to be a great weekend.
Yeah, there's no doubt about that. There's no doubt about that, and
this could
it is.
Be the end of it.
Well, there's no doubt that this will be very painful for many who would have been expecting a very busy weekend, and indeed many others who perhaps not necessarily associated with the business but had things planned, had very significant events planned. We will have more to say about support for business. This is a challenging time for them, we know that, and we'll have more to say once we've done that work. All the way through, we've provided record, unparalleled support to businesses right across the state, and I would reflect on that and put it to you that we've always had a willingness to provide that support where it's needed, but it does take a little bit of time to assess the challenge, but also to then put forward a package, however that might look, and once we're ready to make those announcements, we will.
Because the point being is that many of them are saying they desperately need it now because
yeah, sure. And we're not wasting any time on it, Nick. It's not a matter of announcing it today, but we will be back to you with and to them as soon as we possibly can. We appreciate the urgency of this.
Just on that, it's expected that $100 million will be lost in revenue over these 5 days. $30 million will be wasted in food that's too late to donate. So will businesses be expected to be compensated completely?
Well, as I said, we'll make announcements when we're in a position to do that. We know the urgency of the situation, the work's being done, and we'll have announcements to make as soon as we possibly can. And the time to answer those questions will be once the announcements are made.
Do you think it...
We asked our readers today what the biggest questions they want around
Sure. I'm certain you will, whether I'm happy about it or not. That's the nature of these things.
The top concerns were why are practically walking in lockdown? Why can't returning Australians be vaccinated before leaving out?
Right. A couple of points, and well, this might be just you or me standing here at the end if you've got 5 of them, because that's not an easy one to answer, or not a simple one to answer. Let's deal with the first issue first. Regional Victoria, there's no virus there. I want to keep it that way. If you have soft rules in the country and you have a much harder lockdown in the city and you haven't got time because it's a short, sharp lockdown to get a comprehensive ring of steel up, people from Melbourne will go to the regions. They could potentially take the virus with them. That might see us, things settle in Melbourne. Wednesday comes, we let it off in Melbourne, and then a week later or 2 weeks later we start to see sewerage tests in regional Victoria. That just makes no sense. So I know it's challenging, and I know that it's a bit counterintuitive when people say, well, we're a long way from Melbourne and there are no cases. Yes, that's how we want it to stay. And it just, logic tells you, and experience from last year tells you, if you have different rules without a protective, all the roadblocks and all that sort of stuff, which is not easy to do, it's not done in a couple of hours, it takes time, then people will go to where the rules are easiest, and they might well be taking the virus with them. In terms of people getting vaccinated pre-flight, that's really a matter for the Commonwealth, but I would just go back to the point I made before about we don't yet know whether it's Pfizer or the AstraZeneca vaccine or any other vaccine, just how protective against infection and transmission those vaccines are. And literally the global community of vaccine experts are all working, that's all they've done this last 12 months. But we don't yet have a conclusive answer to what percentage of people who have the jab won't get it and give it to others. We've got really good data, and it's very, very pleasing, really good data that says it protects you against severe illness, but the notion of still being able to give it to someone else, the jury's still out on that. So that would be the only point I'd make, but as to who gets the vaccine and when, that really is a matter for the federal government, particularly for those who aren't here.
Do you understand how tired of this Melbournians are?
Very much so. And, everybody wants this to be over. Everybody wants to get to not just COVID normal, but to normal. But we can't pretend it's over just because we want it to be. As desperately keen as we all are for it to be over, I can't deny the evidence. I can't go shopping for the advice that I like. I can't ignore advice. You've got to make the tough calls, and that's just the job I've got. And that's the job I'll continue doing. And whether it be popular or not is of no concern to me. This is not a popularity contest. It's a pandemic. And when you get advice to make tough calls, it's very painful. It's not easy. They're not easy decisions to make because you know the gravity of them. But there's no option. The last thing any Victorian wants, regardless of their views on me, the last thing any Victorian wants is a Premier who starts shopping around for advice that suits their political purposes. That's not what we're in. We're in a pandemic.
We just heard someone shout, take some responsibility. A lot of Victorians are feeling that way and feeling really upset. Are you prepared to take responsibility that your government has failed once again in hotel quarantine and that's why we're in lockdown?
I take responsibility for everything that occurs in the Victorian government, and my primary and most important responsibility is to make difficult decisions, make sure that they work, make sure that we get on Wednesday night at midnight, we get out of these very painful and difficult set of rules. But that's the approach I've always taken. This is not easy for any Victorian. I appreciate that. I understand that. But it's just not open for me to take the easy choices, to duck the issue, to pretend that it's not real, and then in a few weeks' time, we finish up in a very, very difficult situation. That's much worse than this. As painful as this is, there is, we know, a much worse position to be in. And I will not do anything other than work as hard as I can with my team to avoid that.
What do you say to Victorians who feel like they can't trust you or your government anymore?
Well, that's a matter for them. People are free to have their own views. We're going to get this job done, and I'm deeply grateful to Victorians who, the vast majority, are with us doing the right thing. They are following the rules. The people are free to make their own judgments. That's a healthy thing in our democratic system.
Is it time for the federal government either to take a bigger role or to take over completely hotel quarantine?
No. Let's be very clear. I have never advocated, nor would I, just to kind of handball this to someone else. What I've called for is we should have the experts sit down and we should have a very cold, logical, very, very deliberate discussion where we just do we reappraise the risk of this UK variant. It's not the 2020 virus. It just isn't. And the best example of that is we had a Black Rock outbreak out of Sydney. It was not UK variant. We shut it down in record time. There were some rule changes, 15 to your house and masks and things like that, but no lockdowns were needed. That's not what we're dealing with now. We're dealing with a UK strain, and it is, the velocity of this thing is very, very challenging. Very challenging. What I have said is we should have a genuine discussion about how many people are coming back, the circumstances in which they're coming back, and can we make this safe? Can we make it safer? And I would think that the Commonwealth Government would surely want to be a partner in that, but I'm not looking to handball the thing to someone else. That's not the issue at all. And I'll just repeat what I said yesterday. If there was, and I'm not looking to try and resolve this today, if there was a reduction in the number of people coming back, that's not a cost-saving exercise on my part. We would then turn any and all staff we could from that program onto rolling out the vaccine. That's the real key here. And the sooner we can get particularly those vulnerable people, whether it's in residential aged care or people who've got underlying health conditions, get them the jab, that's the bridge to something approaching, well, COVID normal certainly, and normal beyond that.
On contact tracing, I know that the show has already addressed this, but are you confident and satisfied that we're keeping up with those, especially given that with the double ring testing, that triple digits of contact tracing?
Yeah, it's a lot of people, but I'm very confident that the team is working as hard as they possibly can. And if you see that,
as hard as they can, good enough,
well, people can only,
we're doubting their
look, people can only do their best, and they're all working as hard as they possibly can. And the results you see today, with so many tests, so many people, leads tracked down, interviews done, it's literally thousands of hours of work. They're all doing their absolute best. If you look at the dashboard across the week, they're performing very strongly. It's back to your point about the airport earlier on. I think we're classifying some sites much more conservatively, and when you do that, you know it'll be hard to get to these people because you don't know them. It's not like a primary close contacts in your house or my house where we all know who lives there. We're talking about exposure sites being made, being at the highest level, and it takes some time, and you are a bit dependent on what things people wrote down and all of those sorts of issues, and that's why raw numbers and percentages can not always tell the most accurate and faithful story.
Premier, do you regret your comments last week that Victoria had higher standards than other states and the rest of the country when it comes to hotel quarantine, and that all states were copying Victoria's model?
No, because that's exactly what's happened. Whether it be in testing of staff, that's exactly what's happened. It's a National Cabinet decision. And I think I might have indicated I was not boasting, and just making it's a point of fact. And I think we're all stronger across the nation for the fact that, I can't speak for what's exactly going on in other parts of the country, but as I understand it, everybody's committed to be testing everybody every day. We've gone a step further now. We're testing people on their days off even. No doubt that'll be picked up by others. Again, I'm just speaking to what we are doing. That's the start and the finish of it.
Did you reopen Victoria's quarantine system after last year's catastrophic failures too soon?
No.
How many contact tracers are working at the moment, and are they in those localised hubs that we
They are.
so much about?
They're in a mix. So there's a mix of people in local public health teams working at head office as well. The last update I got, and I'm happy to get you a more definitive number and any breakdown we can, was I think 2,166 people were on this task. They'll be playing different roles. That's as of, and it is from memory, so I will confirm the number for you, but I think that was the number I was given when I asked exactly the same question. Tuesday or Wednesday this week.
And are you planning on is there a need to bring on any more?
Well, I've said to all of our team, if you need anything you need, then obviously it's there. They believe they've got adequate resources now, but if there's anything else that we need, then of course we'll be able to provide that to the team to do the work that they're doing.
And back on hotels just for a second. After a report in the Age today, why wasn't a ventilation audit conducted at all Victorian quarantine hotels prior to the recent outbreak, given it was closed by the poor ventilation that we already knew about?
There were a whole range of checks done. There was a whole lot of work done around these very issues, and the best person to take you through in detail all of that is Emma. She's the one who commissioned it. She's the one who will be able to speak to that for you.
You said you didn't regret reopening when you did the hotel quarantine, but do you have some regrets about what has happened?
Well, you cannot make hotel quarantine zero risk. You simply can't, and I've been very clear about that. And I've said on numerous occasions, far from what's been focused on. The point I've made many times is that it's not a matter of if, it's a matter of when. The challenge for us though is it's not like it was in Sydney, where it was non-UK, so it was the common garden virus. This is different, and just as it was different in Brisbane and it was different in Perth, both of those cities had to close down as well for a short period of time. Obviously, no one wants to have to make these sorts of decisions, but when you have advice, then you have no choice but to do what has to be done. We'll get through this. We'll support people along the way and after, just as we always have. And I want to thank Victorians for sticking together and for being focused on defeating this. And look, my hope is that we continue to see, and we're working as hard as we can to deliver this, we continue to see these negative results, and our precautionary approach sees us Wednesday night, we're able to go back to settings as they were yesterday. We just have to wait these few days and continue to let our contact tracers and so many others do that work, and let individual Victorians make their contribution to this. And we'll have a more complete picture. I know it's frustrating, everyone would like to fast forward to Wednesday and have absolute certainty, but the picture will become more and more complete each day between now and then, Nick.
Will crowds be allowed back to go and open up for lockdown?
That's entirely a matter for health advice, so it'll be, wouldn't be just one event. I think it'd be across the board. So there's a number of different professional sport events, there's a number of different community sport events. These rules don't just affect those venues. And those events, they affect gatherings right across the board. So when we get to that point where we can announce that these rules are off, we'll speak to what the new rules are. And again, it's too early to say whether they'll be just a carbon copy of what it was, or whether there might be some other changes.
On tennis, was it fair that spectators last night were play with pause and spectators were told to leave? A lot of them are not happy. There was a lot of booing in the crowd. Is that fair to chuck them out?
Well, there's a lot of events. Well, I think I went to this in some detail yesterday. We could have made it 6 p.m, we could have made it 9 p.m. Obviously, the earlier you make it, the more disruptive it is, because there's more things that have started but haven't yet finished. You've got to draw a line somewhere, and there'll always be differences of opinion wherever you draw that line. I think midnight was the right call. And again, we don't want to see any events disrupted, but again, we don't have the luxury of avoiding that sometimes. You've got to draw the line somewhere. This is a pandemic. It is not over. It's not over. And I wish it were. We all wish it were. But it isn't yet. And until we get the most vulnerable in our community with a jab in their arm, we're going to have to continue to navigate our way through this. And it's going to be very, very challenging. But I think Victorians are equal to it. Sure, no worries. We've done one. We've got four to go.
Why aren't workers who work in social quarantine
Well, the point I just made about whenever you draw a line, there'll be different people with different views on different sides of it. When it comes to groceries, bottle shops, things of that nature, they're consistent with the decisions we made all throughout last year. So there might be some people who don't agree with that, but they're the decisions that we've made, and that's not a recent thing. That's something that we've right across the country, right throughout 2020. In terms of workers staying on site, there are some capacity issues with that. There is also, just to be clear, you would have to quarantine those people for a lengthy period of time. Look, they're not going to be able to stay there forever. They're going to want to go back to their family and all of those sorts of things. So again, even with a system like that, you wouldn't make it zero risk. There would still be some risk. There has been some discussions about this fly-in, fly-out model, and that should be part of the discussion that I've talked about these last couple of days, based on expert advice about the differences between 2020 coronavirus and the UK strain.
Just on the UK strain that you're talking about, how is it that New South Wales has been able to deal with getting the UK variant inside their hotels and Victoria can't?
Well, I don't think that's accurate.
What's not accurate?
Well,
There have been cases of the UK
well,
variant
you're putting a
inside
contention to
hotel
me. You're
quarantine.
putting a contention to me, and I don't agree with that.
But it didn't get out of Sydney's hotel and it's gotten out of Victoria's hotels. So I'm just wondering why you think that is.
Well, I think you're fundamentally wrong when you say it didn't get out. The virus got out of Sydney. It got out of Brisbane. It got out of Adelaide. It got out of Perth. And it's got out here as well.
The UK variant.
Well, again, you're drawing a broader contention, and I don't agree with that contention.
I have a question about the index case with man who's still in ICU. I'm not sure if
Yeah, that won't be for me, I don't think.
might be in better place to explain this. But earlier this week, Professor Sutton, you said that the working assumption was that family of 3 had caught the virus outside of the hotel, i.e. in the UK where they boarded, or on the plane, brought it into the hotel. But we've since heard the AG spoken to that man. He tested negative before he got on the plane. He tested negative when he arrived, and then he tested negative on day 3 of his quarantine, then tested positive on day 11. Is there any, could he have caught it in the hotel, and how have you ruled that out?
Well, the incubation period for all of these viruses is 14 days, so clearly it could have been caught any time in the 14 days prior to that positive result, and he might have been positive if he'd been tested earlier in that hotel quarantine period. Conceivably, people can have a period of time where they're positive without showing symptoms or never show symptoms. There's a lot of virus in Europe. I think you can be as precautionary as possible, but the force of infection pressure in those countries for people who are getting on planes is really tremendous. And so I think the likelihood is it's still been acquired there, no matter how precautionary he's been. And I take it on face value, he did everything in his power to protect himself and his family. Equally on the plane, people are wearing masks, but everyone sits down for a meal. There are a lot of people sitting next to each other. It's a closed internal environment for hours and hours on end. And so that's a risk as well, transmission on the flight. That said, we don't have a match with others who were on that flight who also subsequently tested positive in hotel quarantine. So I think it's been acquired in country of origin.
There's no risk that there's another index that is in that hotel that we don't
Well,
know
we
about?
would have found that. Everyone's being tested through the entire hotel quarantine period, early on, at the end of quarantine, and again, this is a detection that has been linked to no other cases in hotel quarantine that might have been, transmitted on the flight or earlier. Say again? Oh, so there's multiple levels. There's a kind of primary care through HCA providing a routine medical assessment and responding to any kind of primary care needs, if you like, and also able to escalate appropriately. And Alfred Health can step in if people have complex care needs, and they'll look after them in a complex care hotel setting where they continue their quarantine, but can have chronic illness or complex illness dealt with as well.
Back on ventilation in hotels again.
Sure.
Would you be willing to and open to releasing the reviews of the ventilation done? I guess, if one was done into holiday before it was included in the program, is that something that would be publicly released?
Oh, look, you'd have to speak to Emma about what was done, but there's been a process. And again, I just want to be clear, the theory is not a ventilation problem. The theory is that the nebulizer was the issue. That's the theory. Again, I'm not making any judgments or reflections or comments on the individual. That is the working theory. Not that there's a generic airflow issue. It's all back to the use of that medical device. That's the theory. But again, you are free, and I'm sure you will raise those matters with her.
I mean, you've repeatedly said, the buck stops with you if there is in fact a reporting to it. Is that something you support that's being addressed?
Look, again, you should speak to her about what was done, and she can take you through all that detail and answer any questions you've got.
Restriction questions quickly. Schools are closed for everyone except for vulnerable students. Childcare is open. What about kinder?
Kinder is being treated the same as childcare.
As childcare, so kinder is open.
And the key point was that it would be, for many people who could otherwise work, whilst those services are still there, it would be obviously very, very disruptive, and there wasn't really a need for us to do that. So again, a judgment that some will support and some won't, but kinder and childcare are the same, and schools are closed except for vulnerable children, and also, let's not forget, the kids of those who are going to work and can't work from home. That would ask people to use a good judgment, and we want that to be as small a number as possible, but schools are also there for those families as well.
Elective surgery, has that been affected by the lockdown?
It has been, so
How are you planning to clear the backlog for
well, this is 5 days, and I apologise to any patient who is in the back end of Category 2 or Category 3 and who will have to have their surgery put off. But we are in the midst of a very significant blitz to try and make up the ground that was lost by this pandemic during 2020, and we are absolutely determined to do that. But the last thing anyone wants to do is to go in for surgery and potentially contribute to the spread of this virus or get this virus. It's all based on medical advice, and it is the only way to go.
People
That's it.
who got moved from the Holiday Inn and moved to another hotel in the CBD and have to do an extended period, do they have to pay for the extra time that they're going to have to spend in hotel?
I don't have the answer to that, but I'm happy to get it for you, and no doubt for them, they'll be interested in that answer as well. Of course, you can.
That's on the people who are essentially more than happy to retire. Do they have like a strict checklist that they must ask these people? Sort of what's included in that list, just in terms of asking about the nebulizer and how that was
They're almost certainly questions for Emma Cassar, so this afternoon she'll be able to answer as the Commander Operational Lead for quarantine. But yes, there's a checklist, there's a routine process that goes through with every arriving international traveller.
Professor, that new infection site, this might be for Jeroen, the Point Cook Cafe, is that related to today's new infection? And the Albert Park Cafe as well? Yep.
No other issues? Thank you. Thank you all. Please get tested if you have any symptoms whatsoever. That's the most important thing to do. We'll probably see you tomorrow.